Well, thank you so much, and I want to thank everyone for joining us today. I know you're all very, very busy. And as you've all heard, Health Canada has just approved the use of the AstraZeneca vaccine. And this is absolutely great news for Ontario and the entire country. This gives us a third vaccine as we enter into the next stage in our fight against COVID-19. Yesterday, we spoke with joint hospitals, PHUs, to discuss our vaccination plan. But it's important that I speak with you today about the vital role you're going to play. And it's absolutely critical, each and every one of you playing a role in the execution of the vaccines here. In executing the Ontario Vaccine Distribution Plan, the most comprehensive vaccine rollout in the entire country. This plan is being tailored to the unique populations and geographies in each of our 34 public health units. To execute, we have pulled together healthcare experts, business leaders, and frontline workers in every corner of our province. We will also be relying on an army of volunteers. Everyone will have a role to play. This will truly be Team Ontario. And our municipal partners will be at the forefront of this effort. We'll be counting on you, not just to execute our plan, but to help us make it better. Like I said to the hospitals and PHUs, you'll be the closest to the vaccination delivery. You will know what's going well and what might be improved. If something can be done better in your city, because everyone's unique throughout the province to a certain degree, you can call, and feel free to call me or call the general, and we'll make sure that we're there to support you. You all have my phone number, and I need to be hearing from you regularly. This is the most important thing we're going to do, and we need to get it right. The AstraZeneca news is absolutely great news today. It's a game changer. We need all the vaccines we can get, but adding a third vaccine to our rollout plan does add complexity. So let me say again, we're 100% confident in this team. We'll be nimble, we'll adapt, and we will succeed. And just to give you a quick number, 94% of all vaccines we have in the province have been vaccinated. So that's 94% of all vaccines that we have been administered. And thanks to you, and thanks to the hospitals and the PHUs. I'll now pass it over to General Hillier.
Premier, thank you, and ladies and gentlemen, good morning, and thank you for the opportunity to provide some brief remarks on the vaccination rollout and where we are right now. And I would echo, first of all, what the Premier has said about the great news that AstraZeneca is approved, and now all we await are the details of its characteristics in the monograph that comes from Health Canada that tells us to which populations it would be best used, and then we will finalize how we will roll it out here in Ontario. And then we wait, obviously, to see what shipments we will get and how soon we will get them, but we will be ready for them no matter how quickly they arrive. It is great news, and I hope that following AstraZeneca, there are one or two more others or even more approved so we can have them available, because we all want to get a level of protection into the people of Ontario as quickly as possible, starting with those in the most vulnerable circumstances, and we are consumed with doing that, and more vaccines, more different types of vaccines would help clearly. As the Premier said, the COVID tracker puts Ontario over 90% as vaccines received as of last Monday into arms, and that's pretty incredible. The only province that had done better than that was Prince Edward Island, and I think the scale of our challenge for the vaccination rollout is high for sure, but more than 90% of the vaccines received as of last Monday were into the arms of the people of Ontario. As of this morning, we are almost at 675,000 needles that have been used to vaccinate people in Ontario. 675,000 people. Yesterday, we had 25,000 vaccinations. Today, we will go higher than that, and we will continue to build in next week. And our goal for middle to late next week is 50,000 vaccines per day. AstraZeneca on top of that if we receive it that early. We are continuing with those in the most vulnerable circumstances, those in the long-term care homes, retirement homes, and elder care facilities. All of them had received first visits with the first dose, and now most of them have been receiving the second visits to receive the second needle and be completely immunized. We are also restarted this past week the healthcare workers, particularly those patient-facing, and that's where our focus is right now, to give them the level of protection that they need as they look after all of us during this pandemic itself. We continue with what we call Operation Remote Immunity, that operation in the north to deliver the vaccine and the vaccination program to the residents of 31 isolated fly-in only communities. We are now in month 2 of doing that, and as of yesterday we had 10,000 vaccines, more than 10,000 vaccines into the arms of the residents there in more than 25 communities out of those 31. We have already started in the first communities doing that second needle. We are responding to outbreaks when they occur, and bigger outbreaks in particular, as part of the management, for example, of the COVID-19 outbreak in the shelters for the homeless here in Toronto. We will use some vaccines to help in the management of that outbreak itself. And starting this week, as part of the population who are in the most vulnerable circumstances, as directed by this government, we will allocate 10,000 vaccines per week for the Indigenous adults who are in those prioritized communities, prioritized as being more at risk in Ontario than the other Indigenous communities, and start vaccinating them with 10,000 doses per week. And then already, even though provincially, we are going to roll out across the province 80-year-old adults and older on the 15th of March, or the week of 15th of March, we are actually starting to do that already in some of the public health units. And I know that Wellington, Dufferin, Guelph Public Health Unit, Dr. Mercer and her team are already well over the majority of the people over 80 years old in their public health unit who have been vaccinated with that first needle. It's also happening in Ottawa, and today, tomorrow, through to Monday, we'll start in 5 or 6 other public health units. The public health units know their populations. They've been working at the top priorities, and as they exhaust or finish, or as close to finish as they can be with those populations, and if they have vaccines, they can start with the 80-plus-year-olds in their area of responsibility. We have empowered them to do that, and that's exactly what they're doing. So our vaccination program is rolling out, and as AstraZeneca comes on board and gives us the characteristics, we will add that to the mix and carry on with what we are doing here to get the level of protection to the people of Ontario that we possibly can. Thank you.